Respiratory.
Hello.
Hello, Mr. Foster. How are you doing today?
Good.
Good. My name's Tori, and I am part of the respiratory care department, and I'm going to be helping you administer some breathing treatments today. Is that okay?
Mm-hmm.
Okay, great. So could you please confirm your full name and birth date?
Oscar Foster,
Mm-hmm.
12/23 of 75.
Okay, all right. Okay, Mr. Foster, before we get started here, I just need to listen to your breath sound. So I'm going to have you sit up for me nice and tall.
Okay.
And I'm just going to have you take some nice deep breaths for me, okay?
All right.
All right. Okay. All right, we're going to go ahead and get your vitals here quick before we get started. Okay, Mr. Foster. So today your doctor's prescribed for you 3 different medications, and they're going to help open up your airways, okay?
Okay.
So the first med that we're going to learn how to use is called Brovana. Brovana is a long-acting bronchodilator. So what that means is that it's going to open up the airways for you. This is something we're going to take in a nebulizer treatment, and it's going to start working in about 15 minutes.
Okay.
The treatment itself lasts 5 to 7 minutes approximately, and this is going to be taken 2 times daily, so every 12 hours you'll take this, okay? Alright, so to use a nebulizer treatment, it looks just like this. You go ahead and put the medication in right up here. But we need to make sure it's plugged into the air compressor and the electricity, okay?
Okay.
So to use this, you just wrap your lips completely around the mouthpiece here and breathe normally. Every few breaths, you take a nice deep one, okay? And it'll start to sputter when it's just about empty. You can give it a couple little taps if you want to get the rest of the medication out. And so you know it's working when you see the mist coming from each side, okay?
Okay.
Alright, so that's how you would use that. Go ahead and wrap your lips tightly and breathe normally with that occasional deep breath. Great. Okay. And I'm going to have you take a deep breath and then cough for me. Alright, super. So Mr. Foster, the next medication that your doctor has prescribed for you is called Spiriva. Spiriva is going to be given to you in a dry powder inhaler, so I'm going to show you how to use that. Spiriva is also a long-acting bronchodilator, and it's going to help keep those airways open as well. You take this 1 time daily with 1 capsule that's punctured inside of the inhaler, okay? It starts working in approximately 30 minutes, and it's going to last a full 24 hours, which is why we only take it every day, once daily. This is really a quick process, so you're basically just breathing in and that's it. So this could take, 1 to 2 minutes or less, okay?
Okay.
So to use this Spiriva, you just go ahead and you open the shield here. It's going to reveal the mouthpiece. You go ahead and take a full exhalation to the side. That means breathe out as much as you can. Get as much air out as possible. And you don't want to breathe into the mouthpiece here because that'll clump up the powder and it's not going to work as well and you may not get a full dose. Okay? So turn your head to the side, breathe out as much as you can. Wrap those lips around this and breathe in deeply. There you go. That's perfect. And now hold for about 10 seconds. Okay, great. Exhale. Very good. I just want to point out that we do have a dose counter on the front of this DPI. This lets you know how many doses are available. So if we're taking this just once daily, it'll just go down by 1 each time. And that's how you know when it's time to call the pharmacy and get a reorder, okay?
Okay.
Okay. I'll have you take another deep breath in for me and cough. Alrighty, and then Mr. Foster, our last treatment today is called the QVAR HFA. This is a meter dose inhaler, and it looks just like this. It looks probably the most similar to what you think of when you think of the word inhaler, right? This is actually a corticosteroid. So what that does for you is it reduces inflammation in the airways, okay? So this is going to be taken 2 times daily. And you're going to take it every 12 hours.
Okay.
Now, like the Spiriva that you just took, this is another really quick medication to take. 1 to 2 minutes or less usually. It's just quick. So to take this here, the Q-bar, so you're going to wrap your lips nice and fully tight around the mouthpiece here. Now when you breathe in, as you breathe in, you're going to dispense the canister, okay? Important things to note when you're taking this kind of medication. The first thing you have to do is shake it up really well, okay? That's very important the first time you use it, every time.
Okay.
Even if you take 2 puffs, okay? The other thing that's important when using a meter dose inhaler is that if it's been a while since you've used it, you really need to discharge 1 dose into the air. That way you know you're getting the full dose, okay? So once you've shaken it up, go ahead and wrap those lips tightly. And then you're going to push down on the canister as you breathe in simultaneously. You're going to hold that breath for 10 seconds. And then you're going to exhale, okay? So I'm going to let you go ahead and do that now. Make sure you shake it up good. Very good. All right, wrap those lips tightly and dispense. All right, and hold that breath. And exhale. Okay. Need you to take a deep breath in and cough for me. Okay. So, because you just took a corticosteroid, which can cause thrush in the mouth, it's really important that you rinse. So just take a little bit of water, don't swallow, swish it around and spit, okay? Just prevents any buildup inside the mouth there. Okay. All right, now, Mr. Foster, as with any medication, there are side effects with the medications that you've been prescribed.
Mhm.
Some of the more minor side effects might be headache, dizziness, nausea, dry mouth, okay? There are some more serious side effects. If you experience these, it's really important that you contact your primary care physician as soon as possible, okay? Those include anything such as tremors, eye pain is another one. If you feel like your heart is racing,
Mhm.
we don't want that. Really, anything that's making you question it, okay?
Okay.
Contact your primary and he'll take care of you, okay?
Okay.
I need to go ahead and take one more quick listen to your lungs and get your vitals. That's so we know that this treatment is working. And if it's not working, we can adjust, okay?
Okay.
So go ahead and sit up nice and tall for me one more time and continue to take those deep breaths. Mr. Foster, I'm going to take your vitals here one last time. Alrighty. Mr. Foster, do you have any questions for me today about your treatments, how to use these different devices?
No.
Okay. If at any point you do have questions and you'd like clarification, please call. We'll be glad to answer any questions that you may have. We want you to be confident and comfortable using this, okay?
Okay.
All right. So if you do, just make sure you give us a call.
Sure can.
Thank you very much for your time.
Thank you.
All right. You have a nice day.
You do the same.
Thank you.
Mhm.